if we have high GKI all the time, we put ourselves at risk for a broad range of chronic diseases and mitochondrial damage as the result of a variety of insults on the efficiency of oxidative phosphorylation. But if we go down into the green zone, which is a GK of 2.0 and below, we're going to put a world of hurt on these cancer cells. But how long do we stay in the green zone before we flip back up to a yellow? In other words, going up and down, because our bodies, just like you said, Nick, we evolved to be in these different states seasonally. Where the cancer cells are not flexible, but our bodies are flexible, and we can actually eliminate these tumor cells gradually by taking the full power of the health ability of our body and marginalizing these tumor cells out of existence. So you're right. We need to know about how our bodies work. What does it mean to be in metabolic homeostasis? What do we do in these? How does our body maintain metabolic homeostasis in different zones of the glucose ketone index? And this is, we're working with Greg Glassman, former owner of the CrossFit, Emily Coomer Kaplan. We're going to build these MetFix boxes where we're going to be able to train people to know how to use the glucose ketone index monitor to put themselves into different zones, switching from the zones that you have mentioned, to make our lives more meaningful, but knowing that we can, by moving in and out of these zones, we can keep ourselves at a much higher state of health, and we would have it on our cell phones so that we can then monitor on the cell phone at any given time what your GKI is, and knowing what zone you're in relatively on that particular day, and how long you want to stay in these dangerous zones and how long you want to stay in that super healthy zones becomes a personal choice.